Hi, my name is Jessica Musto, and I'm a liver transplant fellow at the University of Wisconsin-Madison. I'm going to be talking about hereditary hemochromatosis. Pump out that iron. So what is hereditary hemochromatosis? It's a condition where the body stores too much iron. The body continues to absorb iron from food, even though there's plenty of it already around. This excess iron is then deposited in the various organs of the body, and this leads to the clinical manifestations of hereditary hemochromatosis. So what causes it? It's caused by a genetic mutation in the HFE gene, which controls the amount of iron that the body absorbs from food. These mutations in the HFE gene are passed from parents to children. How is it diagnosed? Those suspected of having hemochromatosis should talk to their doctors, who can draw blood to check iron studies. If iron saturation is greater than 45% and ferritin, which is a measure of the body's long-term iron stores, is greater than 150 in women and greater than 200 in men, genetic testing for the HFE gene mutation should be pursued and can confirm the diagnosis of hereditary hemochromatosis. So what happens when there's too much iron? Excess iron can be deposited in the pancreas and cause insulin-dependent diabetes. The extra iron can also be deposited in the joints, causing narrowing of the joint spaces and joint pain. Iron can also be deposited in the pituitary gland, which is a gland in the brain, and cause a lack of menstruation in women and erectile dysfunction in men. It can also lead to a loss of sex drive. Iron can also be deposited in the heart, which causes abnormal heart rhythms or arrhythmias and heart failure. In the liver, iron causes an inflammatory response, which can cause scarring of the liver or fibrosis, and ultimately cirrhosis and liver failure. In the skin, iron causes a bronze or gray discoloration. Hereditary hemochromatosis is sometimes known as bronze diabetes for these reasons. So what's the treatment? Hereditary hemochromatosis is treated by regularly removing the blood from the body through phlebotomy. This is the same as going to the blood bank and donating a unit of blood. Early on after the diagnosis, 1 pint of blood is removed 1 to 2 times weekly. Once iron stores have returned to normal, blood is removed less often and based on iron studies, typically every few months. So take-home points, hemochromatosis is a disorder of too much iron in the body. It's caused by a genetic mutation in the HFE gene, which is passed from parents to children. If the disease is suspected, iron studies are the first step in diagnosis, and if they are abnormal or concerning, genetic testing for the HFE gene mutation can confirm the diagnosis. Excess iron is deposited in the pancreas, joints, sex glands, heart, liver, and skin. Hemochromatosis causes scarring of the liver, cirrhosis, and liver failure. Treatment involves regular removal of the blood through phlebotomy. Early detection of hemochromatosis greatly improves outcomes, so those who are concerned should talk to their doctors, who can do additional testing to confirm the diagnosis.